Today's video is a little more personal because I want to talk to you about something I've been noticing in Ruby that's been on my mind lately. I've seen her back legs getting weaker. Sometimes she stumbles, other times she has a hard time standing up or getting her footing after lying down. We've blocked one of the steeper set of steps so she doesn't get hurt and just installed a dog ramp. As the owner of a dog with epilepsy, I've learned to be constantly aware of changes, big or small. And what I'm noticing now has me wondering, is this just old age or could it be ataxia? So I dove into some research to learn more and will be reaching out to Ruby's vet. And as always, I'm sharing that journey with you because maybe your dog is showing similar signs and you're wondering the same thing. Welcome back to Learn with Ruby. I'm Mandy and my dog Ruby has epilepsy. This channel is all about sharing what I've learned over the last 8 years of caring for Ruby after her epilepsy diagnosis to help you feel confident and supported while caring for your dog with epilepsy. Ataxia is a term that means a lack of coordination or control over movement. In dogs, this usually shows up as stumbling, swaying, unsteady walking, dragging paws, or trouble standing. There are 3 main types of ataxia in dogs. Cerebral ataxia, related to the cerebellum of the part of the brain that controls coordination. Vestibular ataxia, linked to balance issues, often involving the inner ear or brainstem. And sensory or proprioceptive ataxia, caused by damage or pressure on the spinal cord, making it hard for the body to know where its limbs are. In dogs with epilepsy, ataxia is often a side effect of an anti-seizure medication, especially when those medications impact the brain's motor control centers. Many anti-seizure drugs work by calming down overactive brain activity, and while that's necessary to prevent seizures, it can also affect parts of the brain that handle coordination. Some of the most commonly used seizure medications like phenobarbital, zonisamide, levetiracetam, or Keppra have all been reported to have the potential side effect of ataxia, especially when doses are too high or when multiple drugs are used together. And here's the thing, the effect may not be immediate. With long-term use or as a dog ages, side effects can become more noticeable or problematic, even after years of being on the same treatment. For Ruby, this is something I'm starting to wonder about. She's 10 now and has been on seizure meds for over 8 years. The changes in her movement have become more noticeable over the past few months. Diagnosing ataxia isn't always straightforward. Your vet will likely do a neurological exam to look for signs of coordination issues, possibly run blood work to check medication levels or rule out metabolic causes, use imaging, x-rays, or MRIs to rule out spinal issues or brain abnormalities, review your dog's medication history to assess whether one or more medications could be contributing. If you're seeing signs like stumbling, unsteady walking, or weakness in the back legs, especially in a dog on seizure meds, it's important to document what you're noticing. That's exactly what I'm doing right now with Ruby. I've started taking short videos of her walking so I can show her vet what's happening. Sometimes we see things at home that might not show up in a quick clinic visit. Treatment depends on the cause. If the ataxia is medication related, your vet might adjust the dosage, space out medication timing, try an alternative anti-seizure drug, or add physical therapy or supportive care to improve strength and balance. If it's due to something else like spinal issues or a neurological problem, then the treatment plan will look different. But the key is, ataxia doesn't necessarily mean the seizure meds need to be stopped. Often it's about fine-tuning the plan so seizures are controlled and your dog stays as mobile as possible. As someone who's walked this road with Ruby for years, I know how hard it is to notice something's not quite right and feel unsure about what it could mean. I'm sharing this because maybe you're noticing something similar in your own dog. It doesn't mean panic, it just means pay attention, ask questions, document what you see, and always bring your concerns to your vet. That's what I'm doing too. I'll keep you posted on what I learn as I talk to Ruby's vet and possibly a neurologist. Please like and subscribe. That helps others find my videos who might be looking for information about owning a dog with canine epilepsy. Thanks for learning with me as I learn with Ruby.